It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante, and guess what, folks? I'm here at the Lehigh Valley Health Network Cancer Center on the Airport Beltway, okay? You know all about it. It's a fabulous place, and today, folks, we have three very interesting guests. All right, two of them been on the show before, but we're going to bring you up to date on the modern things that are happening with Lehigh Valley. I've told you many times, you know, Lehigh Valley Health Network just raises the bar like it's crazy, and I'm excited. I'm sure all the good doctors and people who work in the network are excited as I am. Now, my first guest, no stranger to the show. You're getting to be a regular on this show, aren't you? You're not taking my job, are you?
Yeah. How's it pay?
The pay's not too bad, I'll tell you. You know, they give me like $4.50 an hour. It's not too bad. You know, Dr. Hotchnet here, folks. Dr. Harvey Hotchnet, who is an oncologist with the physician group. Well, doctor, first of all, congratulations.
Thank you.
This place is absolutely beautiful. Latest technology, just great for the greater Hazleton area. Well, tell us about this place.
Well, it's a you know, we just brand new opening, and we have it set up that we can see people from the clinic point of view, where we can help diagnose, set up treatment plans, and then we have a chemotherapy suite where we treat people with chemotherapy, blood transfusions, iron infusions. So it's basically nothing we can't treat here that you wouldn't do anywhere else.
So they're all the services?
All the services that any infusion center or oncology center would.
Okay, so the office is located here on the Airport Beltway. Okay?
Right.
All right. So, doctor, we mentioned this on the show before. When it comes to times, you know, we mentioned your background and the experience you have. What do you bring to the cancer center, you personally? Well,
you bring many years of experience, keeping up with the newest. We follow clinical pathways. We have exposure to the newest protocols, and we have the expertise of Lehigh Valley. If we need any input from super specialists, we can get it through a Lehigh Valley system.
Now, I'm a strong believer in prevention, all right? And sometimes you can lecture and tell people not to do this, not to do that. But you see it almost every day, okay? Some of the dangers here that we're talking about, the importance of why it is so critical that people should not smoke. I mean, I feel like a broken record sometimes, you know, on my show, you know, especially when I see young people smoking. It just breaks my heart.
Well, when I usually give lectures, when the top 10 reasons for lung cancer is #1 is smoking, and #2 is smoking, #3 is smoking. You go all the way down to probably the first 9 reasons is smoking, and then environmental exposure, you know, from asbestos is probably the last reason. I mean, there are about 5 or 10% of people who get lung cancer for no genetic reasons, but that's a minority of people.
All right, so what do we tell the older people who are in their 70s? You know, I'm not going to say I can't blame them for smoking, because back in the 50s, from what I understand, they would advertise. I mean, people would do doctors smoking, Camels, etc. So they were, you know, but now in the last number of years, there's been so much education. What does specifically the smoking do that is so dangerous, especially to young women? You know, I can't get it in their heads.
Well, I mean, it's not that it's worse for young women. It's just women at one point were not smoking as much as men, and now they're reaching the same statistic as men in terms of risk of lung cancer. So I don't know if it's any worse for women. It's just they're just smoking as much as men right now.
What do you tell people who are smoking? I mean, I know it's easy to say stop smoking. Is there a process here that you could go through for prevention of smoking?
Well, I mean, it's an addiction, and it's very difficult for people who are addicted to smoking to stop smoking. I mean, we know if you continue to smoke when you have lung cancer, it's a negative impact on your outcome. But if people are not willing to stop smoking, you can't do anything about it.
All right, so now here's a smoker, and they're starting to detect something, and now you discover that there's something there. Okay, what would be like the first step if a person's smoking right now, has been smoking for years? What would you recommend them doing?
Well, I mean, Dr. Friedman will talk about there are now national standards. If you smoke more than 30 pack years, that you have screening tests, CAT scans that we can do, look for early prevention, early diagnosis.
So your specialty here is, again?
We'll do general medical oncology, benign hematology, and we also deal with coagulation problems. People who get pulmonary embolisms and clots in their legs, and so we do benign anemias and everything else. So we cover all the bases.
You got to share a personal story with you. The very first time you were on the show, okay, with Dr. Evans, you had a patient, okay, well, you have a patient, and the patient happened to see me and came up and said, you know, Sammy, when you were interviewing Dr. Hotchnet, he was 100% correct, and he's a great doctor. You know, so I just wanted to share that with you, okay? Sometimes all the good work you do is really appreciated, okay? Dr. Harvey Hotchnet, folks, he's one of the oncologists right here. Brand new cancer center on the airport beltway. Now the phone number, 570-501-1242. Don't be afraid to call if you have any questions whatsoever. Coming up next is Dr. Michael Evans. He was on the show before. I'm looking forward to talking to Eliot Friedman, who is the chief. We got the big boy here today, folks, and we'll fill you in on what's going on here in the hematology and medical oncology. Remember, again, 570-501-1242. Thanks, Doc, for coming on the show again. Keep the good work up. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, all of our health shows are on the website, ssptv.com. My email, sam@ssptv.com. And folks, guess where I'm at today? I'm at the new Cancer Center, the Lehigh Valley Health Network Cancer Center, Hazleton, on the Airport Beltway. The number here, 570-501-1242. Now, folks, it's my pleasure to introduce you to Dr. Eliot Friedman. Now, Dr. Friedman is the Chief of Hematology and Medical Oncology. What does that mean there, the good doctor?
I run the medical oncology practice, hematology practice at Lehigh Valley. We're owned by the hospital, just as this practice is owned by Hazleton. We now have 16 doctors in our practice, 2 affiliated practices here in Hazleton and also in Lehigh, bringing us to a total of 20 oncologists, and I try and manage this team.
You're doing a pretty good job. Now, I have here the United States Preventive Service Task Force, okay, has found evidence how to support low-dose computed tomography screening for lung cancer for certain individuals. Can you tell us who should have this test? Because I was alluding to that with Dr. Hotchnet about the smoking.
Sure. We've tried to find lung cancer at its earliest stages for a long time. The original screening tests started in the 1980s looking at chest x-rays, and they didn't find that these tests, doing a chest x-ray on people with smoking history, would reduce their risk of dying from lung cancer. So that never became a recommendation for trying to find lung cancer at an early stage. We know that if you find cancer at its earliest stages, it's much more likely to be cured. And we're seeing improved cancer cure rates now because of improved treatment and because of improved screening tests. So the United States undertook a huge randomized trial, which took over, I think, about 8 or 10 years to complete, where half the patients got chest x-rays and half the patients got a CAT scan. Looking for lung cancer. And these were patients that had certain risk factors. They had to have smoked 30 pack years, which means 1 pack of cigarettes a day for 30 years, or 2 packs of cigarettes a day for 15 years, anything that added up to 30. They had to have been smoking up to 15 years before they stopped, and they had to be between 50 and 75 years of age. So this study showed that the patients that received CAT scans had a much decreased risk of dying of lung cancer than those patients who got chest x-rays as their screening test. There was over a 20% decrease in mortality from lung cancer. So this was the first time this was proven to be a valuable screening test for lung cancer, similar to mammography and breast cancer, colonoscopy and colon cancer. But it was the first time we had shown that there was a valuable screening test now that could reduce mortality in lung cancer.
So the ages here, you know, what would be the primary age? So if I'm watching the show and I'm a smoker, which is bad, But let's say I am a smoker, or I used to smoke. You said the criteria would be 30, if you smoke 30 packs a year, you said?
30. A pack a day for 30 years.
Oh my gosh, okay.
So that's one pack of cigarettes every day for 30 years.
So if you have, and I'm one of those people sitting out there, what should I do?
Well, first of all, you should stop smoking.
Yes, that's a good one.
Secondly, you should be having conversations with your primary care doctor.
Okay.
And most doctors know the smoking history of their patients and the amount of smoking that they've done during the course of their lifetime. So if you have smoked that much, you should talk to your doctor about potentially getting a CAT scan. Right now, we're working on their various, it has not been, the official codes from Medicare haven't come out in terms of what is charged, but what we've done at Lehigh Valley is the cost of the CAT scan has been $100. So I tell the patients, for a cost of 2 cartons of cigarettes, you can get a test that saves your life.
You know, doctor, there are a lot of people that, and I'm the biggest baby, okay? It took me 4 years before I went for a colonoscopy, okay? And I'm on television every week telling people, you go and do this. Well, I went, okay, Dr. Yamulam, and it was a piece of cake. And, I mean, it was nothing, okay? Right. And now we go, and I felt good about it. It's always that initial, worriment, okay? Absolutely. So what do you tell people like that?
I generally tell people, and they come to us once, unfortunately, the diagnosis has been made. Yeah. But I see spouses of patients who I recommended to they've smoked in tandem with their spouse, and each of them has smoked over 30 years. I said it would do you well to get a CAT scan so that you don't end up where your husband or your wife is right now. But I think it's a relatively easy test. It's a CAT scan. It takes about 30 seconds to do. It's a low-dose CAT scan, so it's a low dose of radiation. There's no injection associated with it, and it's generally done in about 30 seconds to 60 seconds.
Okay. Now, the good news is they go, and they're smart enough to go for the CAT scan. Now, the bad news is you find something.
Correct.
Okay. What do you do?
At Lehigh Valley Health Network, every positive scan is reviewed by a panel of lung cancer experts. And any patient that would have screening here in Hazleton, once it's up and running, will have that same procedure. Any positive scan is looked at. We have a diagnostic radiologist, we have a medical pulmonologist, we have a radiation oncologist, myself, medical oncologist with one of my associates, and a thoracic surgeon. And everybody's looking at that, and we say, is that something to worry about? The better CAT scans get, we find all sorts of benign stuff in the lung as well. So it really takes a very experienced team to be able to determine what's a definitive malignancy, what's suspicious, or what's benign, and what kind of follow-up is needed after that. If you think it's malignant and you think it's definitely malignant, it's got to come out. You've got the surgeon right there to set up the appointment and do the procedure. If it needs follow-up, we either send them back to their primary care doctor. A lot of those primary care doctors like us to follow it. They don't want the responsibility, and we will follow serial CAT scans over time to monitor things. And if there's a change, then we act on it. You know,
the exciting thing about this whole network, when they came into Hazleton, I've been pushing since 1994 about the great doctors we have in this area. And it seems like all these great doctors are now with Lehigh Valley, okay, which I think is fabulous. But the amount of health care that we have available to us, I mean, it's explosive as to how many areas we cover. You just said you got 15 or 20 people looking at that, results. I mean, that's amazing.
It's phenomenal. And I know that in talking with Dr. Evans and Dr. Hotchnet, they have the availability to teleconference in to all of our lung conferences, our lung clinics. So if they have a patient they need us to discuss, the patient can be sitting with them in the office, get teleconferencing with us, look at their scans, hear the opinion of the experts, and get their treatment right here.
There's some people that may have the start of lung cancer that don't know that, okay?
Right.
And you just said if you're a smoker and you smoke for 30 years, if you come for a CAT scan and you do find something, okay, there's a great opportunity here. You have the procedure to do
Absolutely.
that. Yeah. What clinical trials? I mean, the lung cancer clinical trials. You have them?
Oh, we have a whole slew of clinical trials.
What is that?
Well, clinical trials are tests that are set up either through the pharmaceutical industry or through various national cancer organizations to try and improve treatments for various cancers.
Okay.
So these are looking at, we have a number of clinical trials through a large cooperative group network that we belong to, where we're trying to improve treatment for patients who have early stage lung cancer, where it's been removed, and whether we can improve their survival with chemotherapy or other treatments following the surgery. We have a second batch of clinical trials looking at patients that have localized lung cancer that can't be resected to see if we can improve upon the standard of treatment, which is radiation and chemotherapy. And we have other trials that are looking at patients with metastatic cancer. It's already spread outside of the lung, where we have new experimental therapies that are available to us through the pharmaceutical industry. Our relationship coming up with Memorial Sloan Kettering will be able to get us access to a number of clinical trials, and these will probably be coming sometime in the winter, in February thereafter, once we have our official go live date with Sloan Kettering.
Yeah. I just think it's remarkable, really. It really is, you know. And I applaud all the doctors, because not only you guys, you're all dedicated, and you all come with great credentials, which is so great for the Greater Hazleton area. Not only Greater Hazleton area, but anywhere where Lehigh Valley Network is involved. It's nice meeting you, Doctor.
It's a pleasure.
Okay, and thank you very much for coming on the show. Dr. Eric Friedman, folks, he's the Chief of Hematology and Medical Oncology. One other quick question, okay? What if you catch lung cancer at the early stages? What are the percentages here?
If you find something that's truly an early stage lung cancer, stage 1 disease, which means it's isolated to the lung and not spread to any lymph nodes or anywhere else, the cure rate is upwards of probably 75 to 80%.
So there's always good hope.
Very good hope. And the earlier we find it, the better chances.
Get your CAT scans, especially you smokers. So I asked Dr. Hotchnet, okay, how do we tell people, you know, Hotchner says, just quit, stop smoking. But I mean, it's not as easy as is said. It is an addiction, which he said. What do you, I mean?
Well, we have the whole program tied in.
Do you?
It's the national recommendations and the international recommendations from the various lung societies is that if you are doing lung cancer screening seriously, I mean, you could go to a strip mall and they can get a CAT scan, and a CAT scan gets lost and nobody follows it up. But if you go to a comprehensive program, as we have together with LVH Hazleton, it's tied in with smoking cessation. It's tied in with all sorts of counseling to try and get people to stop smoking if they haven't stopped. So it's really you've got to do things in a very comprehensive way, or else to do an isolated test is not going to do anybody any good.
Thank you, Doctor. Dr. Eric Eliot Friedman, folks, he's the Chief of Hematology and Medical Oncology. We're here at the new Hazleton Cancer Center on the Airport Beltway, 570-501-1242. Quit smoking. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. We're talking about healthcare, and we're here at the new Cancer Center, the Lehigh Valley Health Network Cancer Center on the Hazleton Beltway. The number here is the address is 384 Airport Beltway. Now the phone number, folks, is 570-501-1242. Remember, 24/7, you can watch all of our health shows on ssptv.com, and particularly with the Lehigh Valley, it's lvhn.org. All of the health shows we do and the interviews we have with the doctors, so they're very, very informative. Now we had Dr. Hotchner, okay, on the floor, Harvey Hotchner on the show before, and we had Dr. Friedman from the physician group on oncology. Now we have Dr. Michael Evans. Again, another. You guys want to take, you and Hotchner want to take my show, don't you? You're on my show more than I'm on my show.
Well, thanks for having me.
It's always a pleasure, Mike. Dr. Michael Evans, who is an oncologist. Your experience again, because that young kid, they say, that young doctor, okay, and I say he brings a lot to the table. Give me back your background again.
So my experience, I'm trained in internal medicine, which is a 3-year residency program you do after medical school, and then also in hematology and medical oncology, which is a 3-year fellowship program that you do after your residency. And then after that, I was at Penn State Hershey on the faculty for about 4 years before coming here.
I was talking to Tammy before I started the show. I said, you know, it's interesting when now we have this great explosion, I say, in healthcare. And when you're talking about people, God forbid something's wrong, particularly if they have a cancer, the first thing they say is, well, you know, let's get out of town, let's go to Philadelphia, let's go to New York, etc. Well, we're here. We're in New York when we come to the Lehigh Valley Health Network because of the association you're going to have with Sloan, which I think, you know, when I first heard about this, it was phenomenal. Give me a little information about this alliance and what it really means to our community.
So that's a great question. I think starting with what Sloan brings to the table, it's obviously world-renowned, one of the largest cancer programs in the world, and they have many, many doctors. So, you know, talking to Dr. Friedman, the practice in Allentown total is about 20 doctors in hematology and medical oncology. If you compare that to Sloan, I'd just be guessing, but I'm guessing it's probably 5 times that large. And so you have all that expertise there. And it's not really just in medical oncology, it's also a lot of the ancillary cancer-related services. So you have specialized surgeons, you have specialized pathologists, you have specialized radiation oncologists and radiologists. And so the group of doctors at a place like that is enormous. The affiliation for what it means to Hazleton, I think, is that it's an excellent opportunity. You know, we're affiliated with Allentown, obviously, through Lehigh Valley Health Network. And the way that I see it is it's an opportunity to get to the point where we'll eventually be able to offer what they offer in Allentown here, which is going to be, I think, a stepwise fashion, extending the clinical trials from New York to Allentown, and then a next step would be extending those same things here to Hazleton. So to me, it's an opportunity to work towards that.
You know, it's always interesting when you go to a doctor and something's seriously wrong, you know, you'll hear people say, get a second opinion. Well, here you got second, third, fourth, fifth, sixth, seventh. I mean, when Dr. Friedman says you got 20, it's up to 20 doctors, and then it becomes even more, you know, to be more specific as to how to treat that is so very important, don't you think?
I agree completely. You know, I think a good analogy is, you know, kind of comparing a doctor. You know, doctors go to medical school, they treat patients when they're sick, but we do get more and more specialized, and the larger your group practice is, the more specialized you can be. So, you know, in Allentown we have a larger practice. There are people who will, you know, predominantly, you know, take charge in lung cancer or in breast cancer or in GI tumors and things like that. And so, you know, we get the benefit of being affiliated with that network and being able to conference in with those people. When you extend that to Sloan Kettering, it gets divided even more. So you have people who are subspecialized, you know, even beyond just one larger group of tumors. So I think we will have access to the folks at Sloan through the affiliation and to that expertise when it comes time for second opinions. You know, I think that relationship will be there from the start.
And not only do you have that, all the doctors, you also have the opportunity of benefiting from technology and from new creative things that happen. For example, if I'm a doctor in Sloan Kettering and I'm, you know, experimenting with something and I find something that's, wow, this is an opportunity to treat this. Now, this is, I would assume, is also available to Evans and Hotchnet and Friedman and all the other doctors because there's some new technology or new discovery in terms of medicine's always improving. It's amazing. Today, people are living longer than they did before. I mean, I'm thinking about that. Am I wrong in thinking that?
No, I think you're exactly right. And you know, I think Sloan Kettering is on the cutting edge of developing new treatments and new strategies. And you know, it's really interesting to me. And coming here, just in the last year, I have 3 patients who also see doctors at Sloan Kettering. A few of them were established there before I even came to the area. And you know, it's a distance, but you know, a lot of the time patients are willing to travel for that expertise. But it's been nice because you know, with the relationship and with the alliance, I think that doctors at Sloan are going the extra step to reach out and communicate and co-manage patients. And so I think that type of thing will only increase in the future.
Well, Doctor, as a resident who lives in this area, and I'm excited about it, and I wish you guys the best. You know, it's a great team. You know, and thanks for coming on the show again.
Sure.
Okay.
Thank you.
Dr. Michael Evans, folks. Remember, you can get in contact with him here at 570-501-1242. Any questions you have. Now, attention smokers. Attention smokers. All right. You know who you are. You know your smoke. You know it's not good. Now, we got to do something about this. You got to call them. You got to go to your primary doctor, get a prescription. It's not going to hurt. Get a CT scan. Don't be like me, a big baby. Get out there and get it done. All right? You need to do that. All right? Because we want to see you around, and I want more viewers, so I want you around a lot to watch the show. We're here at the Lehigh Valley Health Network, the new cancer center. It's beautiful, folks. Believe me, the latest in technology with 3 great doctors I interviewed today, Dr. Evans, Dr. Hotchnet, and Dr. Friedman. I want to thank them for being on the show. Remember, 24/7, ssptv.com, or go to lvhn.org, and you can watch all of the shows we do. We'll see you next time.